Health officials are using contact tracing in the battle to slow the spread of COVID-19.
CBS 2's Hermela Aragawi got a rare look at the daunting effort to find people who might not know they've been exposed.
Hello, this is Radhika Kumar calling from LA County Department of Public Health.
Radhika Kumar is a public health specialist with LA County, one of 1,500 contact tracers, mostly city and county employees, that call people within the county who've tested positive for COVID-19 and those who may have been exposed.
Sometimes they're expecting the call, sometimes they're not expecting the call. And so it's very important within the first few minutes to make sure that we build a rapport.
Tracers have an interview script based on various scenarios.
It's a conversation, how are things going, what's going on, let's discuss a little bit about your symptoms.
Or
we'll say you may have come into contact with someone who tested positive. So here are some of the things that we need for you to do to make sure that we're curbing that infection.
Health officials tell us they now also ask if the person has been in ride shares, traveled through airports, including which airline, and they check potential exposure through work and family.
We're very, very, very careful to make sure that information remains confidential. That is a very important part of the work that we do.
Education is a key part of what tracers do. For example, how long should someone isolate? The health guidance is if a person has symptoms, they should isolate until they've had no fever for 3 days, respiratory symptoms have improved, and 10 days have passed since the first symptom. If a person tested positive but has no symptoms, they should stay at home for 10 days after taking the test, and if they do develop symptoms, they should follow the previous protocol.
The goal is to get close to 3,000 contact tracers for LA County, just to keep up with the increasing cases and make sure we have adequate numbers of people to make phone calls to people diagnosed with COVID and all of their contacts.
Dr. Sonali Kulkarni is a medical director of LA County's Division of HIV and STD programs and is now helping manage the COVID-19 contact tracing efforts. She says health information is always sensitive, so tracers have to be good listeners and not pass judgment.
If they do share that they did something that's maybe not appropriately socially distanced, we don't provide judgment or do anything to sort of, make them feel bad about that.
The call will either come from an 866 number or it might say LA County Health. Either way, officials say it's important to pick up their call or return the messages. Hermela Aragawi, CBS 2 News.